All right, let's dive in, shall we? Today, we're tackling stress tests.
Uh-huh.
Something that you or someone you know might be thinking about, especially when heart health is on the table.
Right. And we've got a great guide from Medline Plus for this. It's a service of the U.S. National Library of Medicine.
Oh, fantastic. They always have such clear explanations.
They do. They really break it all down about these tests.
I feel like when a lot of people hear stress test, they imagine like the toughest workout ever.
Yeah,
It can be a little scary, honestly.
Mhm.
So hopefully we can, kind of unpack that a bit.
definitely. Yeah. Stress tests are meant to be safe and give you good info. Knowing what's coming can make a huge difference in how you feel about them.
Absolutely. So first things first, what exactly are stress tests, like at their core?
Well, think of it this way. It's not just looking at your heart sitting still.
Okay.
It's about seeing how it does under pressure. Kind of like if you were buying a car, you wouldn't just look at it in the garage. You'd take it for a spin, see how the engine performs.
That's a perfect analogy.
Mm.
So how do they actually put your heart through its paces during the test?
Usually it's exercise. You're on a treadmill or a stationary bike, and they're watching how your heart's doing the whole time.
Makes sense. But what if someone can't exercise? Due to some physical limitation or something?
Good question. They can use medication in those cases. It basically mimics what exercise would do to the heart.
Oh, interesting. So no matter what, they get a good picture.
Exactly.
Now, I'm guessing there are specific reasons why a doctor would say, hey, you need a stress test. It's not just routine, right?
Right. Several situations where it makes sense. Like, say you've been having chest pain that's unexplained, or shortness of breath, irregular heartbeat, even dizziness.
Mhm.
Your doctor might want to look closer.
So it's almost like those symptoms are your body waving a little flag like, hey, pay attention here.
Exactly. But it's not always about finding a problem. Sometimes it's about keeping tabs on an existing heart condition, figuring out the best treatment, or even seeing what exercise level is safe for you.
So it's all about getting a baseline and then making smart choices.
Right. Precisely. And sometimes it's done before surgery just to be sure your heart's strong enough to handle it.
Okay, yeah, that makes sense. So we know WHY, someone might need this test, but let's walk through what actually happens during the test itself.
Okay, picture this. You're in the exam room. They put a blood pressure cuff on your arm and those little sticky electrodes for an EKG.
The EKG, yeah. Pretty standard for heart stuff, right?
Oh, yeah. They're recording your heart's electrical activity the whole time. And if you're not exercising, they might give you an IV for that medication we talked about.
So they're monitoring from the start,
Yep.
and then do they just crank up the treadmill to full speed? What happens next?
Not quite. It's gradual. They slowly increase how hard you're working, either the treadmill speed or how much resistance on the bike.
So it's pushing you, but in a safe, controlled way.
Right. And here's the important part. You got to talk to them during the test. Any discomfort you feel, let them know immediately.
Good to know. You're not just left to suffer in silence.
Nope. They're watching you closely and can adjust things if needed. They want you to finish the test safely and get the most accurate info.
So that's the basic stress test. But I've heard they can get even fancier with imaging technology. It's not just about the treadmill anymore.
You're right. Sometimes they want a really good visual of your heart as it's working. That's where imaging comes in.
Ooh, that's the cool stuff.
Yeah.
It's like seeing inside your own body. What kinds of imaging are there?
3 main ones. First is the echocardiogram.
Okay.
Uses sound waves to make these moving pictures of your heart. You see its size, shape, how the blood's flowing through.
Almost like a sonogram, but for your heart. Amazing. What else?
Then there's the nuclear stress test. Might sound a little intimidating with that nuclear word,
Yeah.
but it's totally safe. They inject a tiny bit of radioactive stuff called a tracer into your blood.
And what does that show them?
It lights up the blood flow in your heart on the images, shows them any spots where blood might not be moving well.
Like blockages or problem areas. Wow. What's the third type?
Cardiac MRI. This one uses magnets and radio waves to create incredibly detailed pictures. They can pick up on even subtle things other tests might miss.
It's like a super high-definition map of your heart.
Yeah.
Technology is wild. But with all these tests and imaging, what are they actually looking for in the results?
A normal result means things are good, blood's flowing well, heart's doing its job.
That's the news you want to hear.
Right. But if it's abnormal, I know that can be worrying.
Oh, yeah. Getting those results and seeing abnormal can't be fun.
Definitely not. But it doesn't always mean something serious is wrong. It just means they might need to do more digging.
So not panic, but more investigation.
Right. This is where talking to your doctor is so important. They'll put it all in context, your overall health, your medical history, all of that.
Because everyone's different.
Exactly. So a stress test is valuable, but it's just one piece of the puzzle.
That makes a lot of sense.
You know, one thing I think about with medical tests is like, how do I get ready for this thing? Are there like special instructions?
Oh, yeah, for sure. I always get a little, nervous about the pre-test stuff. Can I have my coffee? Do I need to fast?
Yeah, good to be aware of that. Luckily, Medline Plus has some advice on that. And actually, getting ready for a stress test is usually pretty simple.
Oh, okay, good. Lay it on us. What should people know?
Well, number one, comfy clothes and shoes are a must, especially if you're going to be on that treadmill or bike.
Right. Makes total sense. Don't want your clothes to be, like, distracting you or anything.
Exactly. And then usually you got to fast for a few hours before.
Oh, so no morning coffee. Is it because caffeine messes with your heart rate during the test?
Yep, that's it. It can throw off the results. Best to avoid it for a bit beforehand.
Okay.
Oh, and while we're on the topic of things to avoid, cigarettes, definitely no smoking.
Right. Smoking can mess with your heart rate and blood pressure too, doesn't it?
It does. Even smoking just a few hours before can affect things. So big no-no there. So comfy clothes, no food or caffeine for a while, and absolutely NO smoking.
Got it. Pretty easy to remember. Anything else to keep in mind?
Always good to double check with your doctor about any meds you're taking. Some might need to be adjusted before the test.
Right, because some meds could interact with the test or change your heart rate. Better safe than sorry.
Absolutely. Always better to be on the safe side and have that chat with the doc beforehand.
Now, we've talked about the, physical stuff with stress tests. But I imagine there's a mental and emotional side to it too, right? I mean, it's called a stress test.
Oh, for sure. It's totally normal to feel some nerves before any medical test, especially one where they're going to push your heart a bit.
Yeah, I bet.
And if you're already having heart symptoms, that can really amp up the anxiety.
So what can people do to, manage those feelings, the nerves, the anxiety?
Talk to your healthcare team. I can't stress that enough. Don't be afraid to say, hey, I'm nervous, or ask all your questions. Let them know how you're feeling.
They're there to help you, not judge you for being a little freaked out, right?
Exactly. And remember, knowledge is power. The more you understand about what's going to happen, the less scary it feels.
Okay, that makes sense.
Yeah.
So let's say you've done the stress test, everything went fine, you're back home. Now comes the waiting for results.
Uh-huh.
Which can be its own kind of stress, I bet.
It can be. But remember, your doctor is the one to interpret those results.
Right, because they have all the info, your history, your symptoms, what kind of stress test you had.
Exactly. And based on all that, they'll tell you what's next. Could be a clean bill of health, could be more tests, could be talking about treatment options.
So it's not like the results are the end. They're more like a signpost,
That's a great way to put it. And it's important to stay, active in your healthcare. Ask questions, understand your options, work with your doc.
We've covered a lot here. What a stress test is, why you might need one, the different types, how to prep, even what happens after the test.
Yeah, it's been a good overview. To kind of add another layer to all this, let's talk about the history of stress tests a little.
Ooh, I love a little history lesson.
Yeah.
Always cool to see how far we've come in medicine. When did these tests even start? Were they always this, high-tech?
No way. The idea of stress testing has actually been around for way longer than you'd think.
Really? I'm picturing, ancient doctors making people run up hills and checking their pulse.
Haha. Not too far off, actually. Early forms did involve exertion, but obviously no fancy equipment back then.
So when did things start getting more advanced?
Early 1900s saw a big jump with the invention of the electrocardiograph, or EKG. That let doctors actually measure the heart's electrical activity, which led to the first EKG stress tests.
Ah, the EKG, those sticky electrodes we talked about, so that they could see the heart signals while someone was working out.
Exactly. Huge breakthrough. And from those simple exertion tests to EKG monitoring, it just kept evolving.
And then, of course, came the imaging, echocardiography, nuclear imaging, cardiac MRI, total game changers.
Oh, yeah. Amazing how technology has changed how we diagnose and treat heart problems. And that brings us to the future of stress tests.
Ooh, fun. What's on the horizon? What's next for this stuff?
Well, they're working on even more sensitive and specific imaging. Imagine getting even clearer pictures of the heart in action.
Wow, so like taking those HD images we have now and making them even more detailed.
Exactly. And there's a lot of interest in personalized medicine, tailoring the tests to each person's specific situation.
That makes sense. Everyone's different.
Right. And with all this AI and machine learning stuff, we might even see tests that can predict future heart problems more accurately.
Whoa, predictive stress tests. Sounds like sci-fi.
It does, doesn't it? But it shows how far we've come and what's possible.
It really is amazing. So we've gone from basic exertion tests to high-tech imaging and even a peek into the future. Quite a journey.
It has been. And as we wrap up part 2 of our stress test deep dive, let's take a second to appreciate how far we've come and all the amazing advancements that are happening in heart health. Stay tuned for part 3, though, because we'll tie it all together with some key takeaways and resources for you to check out.
All right, we're back for the final part of our stress test deep dive.
It has been quite a journey, really digging into how we assess heart health.
We've covered so much, from like the basics of what it is, all the way to the history, and even where things might be headed.
Yeah, a lot to unpack. But before we finish up, let's hit those key takeaways for our listeners.
Yes, let's solidify what we've learned, make sure it sticks.
Okay, so first thing to remember, stress tests are a really powerful way to check up on your heart.
Right, like they can help diagnose or monitor conditions, guide treatment decisions, even figure out what exercise levels are safe.
Exactly. If you're having any of those symptoms like chest pain, shortness of breath, weird heartbeats, a stress test might be on the table.
And even if you don't have symptoms, your doctor might suggest one if you've got risk factors for heart disease.
Right, like family history, diabetes, high blood pressure, things like that.
It's also important to remember there are different kinds of stress tests, right? Each one with its own pros and cons.
Yeah, you've got the basic one where you exercise while they're watching your heart with an EKG.
And then if they need a more detailed look, there's the imaging, echo, nuclear, MRI.
Those give a much clearer picture of what's going on in there.
No matter what test you're getting, though, prepping is key.
Oh, yeah. Gotta be ready. Comfy clothes, no food for a few hours, lay off the caffeine and cigarettes.
Your doctor will give you the specifics.
Absolutely. And honestly, throughout this whole process, talking to your healthcare team is so important.
Can't stress that enough.
Don't hold back on questions or concerns. Tell them how you're feeling. They're there for you.
Now, once the test is done, I know waiting for results can be nerve-wracking.
Oh, yeah, that waiting game is tough.
But your doctor's really the best one to make sense of those results.
For sure. They'll consider your history, your symptoms, what specific test you had.
All of it.
And then they'll walk you through what happens next. Maybe it's good news, all clear. Maybe it's more testing. Maybe it's time to chat about treatment.
So those results aren't the end of the story. Really, more like a chapter heading.
Love that. And you got to stay active in your healthcare. Be your own advocate. Ask questions. Understand what's going on. Partner with your doctor.
It's about taking charge of your health, right?
Exactly. Which brings us to the big picture here. Taking care of your heart.
It's so essential.
We've learned stress tests are one tool, but they're just one piece of the puzzle.
What else can people do to keep their hearts healthy, aside from maybe needing a stress test down the line?
A lot of it is what's good for your whole body, honestly. Healthy weight, good diet, regular exercise.
Classic advice. But so important.
It is. And don't underestimate managing stress and getting enough sleep.
Oh, those are huge. We don't always connect them to heart health.
We should. Taking care of your heart is a lifelong thing. It's about the choices we make day after day.
And it's never too late to start making good choices, right?
Absolutely. Young, old, whatever. You can always do something to improve your heart health.
Love that. Any resources you'd recommend for our listeners who want to dig deeper?
Medline Plus is amazing, of course. We used it for this episode, and it's a treasure trove of reliable health info.
From the U.S. National Library of Medicine, so you know it's good stuff.
Definitely. The American Heart Association is another one. They have tons of resources specifically on heart health, stress tests included.
Fantastic.
And can't forget, your own doctor is the best resource for you personally.
Always. Personalized advice is key.
So any questions, any worries, reach out to them. They're there to help.
Great advice. Well, looks like we've reached the end of our stress test deep dive.
I hope this has been helpful for everyone. Maybe even a little empowering. Knowledge is power, after all.
It really is. Understanding your heart is a big step toward a healthier you.
So until next time, everyone, stay curious, keep learning, and take good care of those amazing hearts of yours.
Thanks for diving deep with us.